Your mic.
Okay. Be nice to be heard. Next guest speaker is the Fair Housing Program. And
Good morning. My name is Chancellor. Good morning. My name is Chancellor Al-Mansour of the Housing Rights Center.
Nice to have you.
Thank you. I apologize for being a couple minutes up at the podium. You have a bunch of kids in the lobby, and by the time I got up here, it was 9:47, and you were running early. So,
your apology is not going to be accepted.
But thank you so much. So it's a pleasure to be here before you today representing the Housing Rights Center. We provide your fair housing enforcement, and we have for several years. We've had a very good relationship and partnership with your residents and especially with your staff as well. We provide basically 4 levels of service. What happens is more than likely a resident will either see one of our flyers, or we do a lot of press releases and advertisements in newspapers. We took out a huge color ad. As a matter of fact, I should have brought it with me in the Daily News. It's going to be running on Sundays, advertising our services, letting people know, tenants know if they have any issues to contact us or the city. They contact us. We have toll-free number. We provide free assistance over the phone and counseling. If it seems like it is a little bit more in terms of discrimination itself, then we will take it as a case and so forth, and as much as represented in court. And one other quick thing, unless there's a pressing question, is your mouth is open, so I'm not sure. But HUD, just one other quick thing. HUD, your CDBG funding, you know, is administered through HUD as well. And fair housing, specifically the obligation to affirmatively further fair housing, is the only mandate that's really required under your CDBG funding, that you have to provide fair housing services as well. And you do that. I know that. I just like to kind of remind cities and different agencies when I meet with them that this is actually a mandatory requirement as well. But thank you very much.
Any questions? Yeah, fine.
Actually, not a question. Obviously, we're very familiar with what you've been doing in Glendale for so many years, and I know you provide a service that our own city, it's just a good benefit for the city in terms of something that otherwise the staff would have to handle. So
Yes.
I know economically is something that's proven to be very efficient, but I guess for the benefit of the public, can you talk a little bit about, you're a big umbrella organization, and the funding that you're requesting from us through CDBG is a very small portion of the services you provide all over LA County, I know.
Yes, and Ventura County.
And Ventura County. So could you talk a little bit about, like how many offices you have, or how it actually works from the perspective of a person that may be having an issue in our city?
I'm sorry, from the perspective of a person?
If I was one of the tenants and I feel I have an issue with my landlord or something,
Okay.
what exactly happens?
Okay. So I have kind of 2 separate responses to that in terms of discussing how we are overall, because a tenant wouldn't necessarily know that or need to, or probably would want to know that. But so I'll answer your first question first, and then how a tenant would come to us. So for our first question is, yes, we do have an overall budget of about $2.4 million. It fluctuates a little bit because, as you all know, we don't know what funding is going to be, and especially for federal funding. But a pretty big majority of it is through CDBG funds. So we do have contracts with about 24 different contracts, including the city and the county of Los Angeles as well, to provide their fair housing services, and then a lot of the small cities, Pasadena, for instance, and so forth. And we also receive what's called a FIP grant through HUD. That's a Fair Housing Initiatives Program grant that specifically funds us to randomly test for discrimination, so we don't have to wait for a tenant to call us and say, I was turned down, but then my friend told me that she went and she was able to get an apartment, and she's, some other race or speaks a different language or something like that. So we received this grant through HUD to kind of do random audits, which we do as well. We also received a grant through HUD to look for design and construction defects in newly constructed apartment buildings and dwellings, especially under California, a lot of California building codes. Doorways have to be a certain width, toilets have to be fully accessible, grab bars, so forth, and all new constructed buildings. Parking lots have to be accessible, the manager's unit, the buzzers. But you'll be amazed that even brand new construction, there'll be stairs going up to the front door to ring for the apartment manager to apply for an apartment. And so I've done that before. I've got gotten out of my car, walked up there, and said, how would somebody in a wheelchair be able to apply for an apartment? They came up there, and she said, well, there's an elevator in the parking lot. Well, the parking lot has a gate, and it's only accessible to residents. So anyway, so I think I answered a little bit of both in terms of how we get cases.
Thank you.
I have no questions.
I had one here, wanted to ask you, looking over your packet, the housing counselors that you have in your staff, are they legal aids or attorneys, or what is their makeup?
Yeah, so our housing counselors are not attorneys. Most of them do have graduate degrees. Interesting enough, most of them, the people we tend to attract are people with graduate degrees in social work, and so forth, which makes sense because obviously we deal with a lot of tenants with mental disabilities, or they're very upset. I mean, they're about to lose their housing, so it has to be somebody who can calm them down, get them to focus, and express their concerns, so we can provide assistance as well. But we have 5 housing counselors. They're all bilingual. One is in Armenian, Spanish, as well.
If a resident has a question or want to go over the lease or anything regarding renting, do they have to call you first, or can they just pop in and see you at that time?
Our doors are open I just remember one part of your question also. We have a small satellite office in the Jackie Robinson Center in Pasadena.
Yeah.
So that may be a little bit closer for Glendale residents to get to. Although, as I was just explaining to Moises, we are right off the metro line as well, because we're on Wilshire Boulevard, so we're pretty accessible by metro. But so they can walk in 8:30 to 5 o'clock. Our doors are open, and Monday through Friday. Yes.
I was looking at your chart here on page 6, and the biggest chart here on your graph is the notices of eviction. You got 26%. I didn't see anything there about discrimination, or is that included in harassment then?
So that could be included in harassment.
It could be included.
Yeah, exactly. I mean, harassment is an act that is covered up by the Fair Housing Act.
On the eviction, it's 26%. I don't have my chart from last year to correspond that figure to last year. Is this pretty much an increase, or is it?
Evictions are going up a little bit because the economy is getting better. When the economy is really bad, landlords oftentimes would give tenants a little bit extra time to pay their rent, because it's expensive for landlords to go through the eviction process. It costs about $247 to file, if that's without an attorney, have the tenant served, and all of that. It's about a $500 process to try to get a tenant evicted. But when the economy is getting a little bit better, landlords can be a little bit choosier. They can afford to go through the process. So we do predict that as the economy gets better, and as owners get out of mortgage foreclosure type situations themselves, evictions will pick up a bit. At the same time, though, evictions based on non-payment of rent has been really, really high, obviously, because of the bad economy. So we expect those evictions based on non-payment of rent, hopefully, to go down a bit.
Does your Housing Rights Center, when you have a case of a tenant that's strapped, maybe lost their job or so on, and is looking for new employment, do you help fill the gap there as far as that end, as far as monetary until that, or what is the position there then?
We would love to. Unfortunately, the HUD regulations state that you can't use CDBG funds to provide that type of monetary assistance. There was other federal funds through the HPRP program, the Homeless Prevention Recovery Program, under President Obama's Americans Recovery Act, but it ended last year, the funding for that, and that would have provided a tenant with rental assistance as long as they had a job on the horizon and that type of thing. But unfortunately, the federal funding ended for that program.
Okay. Any other questions from here?
I have a quick question to staff about this, and Moises, if you can answer this. Along the same lines that I asked with the previous group, $9,000 was approved last year, and the amount that was requested is the same as the amount that's being requested for the next year. So 9,000 a year fund for you to administer, is that still in the okay zone for you?
Yes, Mr. Sinani, that's fine.
Okay, thank you.
I think that concludes the questions from us here. Just want to thank you again for taking your time, effort, and energy to present your program to us, and you're doing a nice job.
Thank you so much. I appreciate it. Thank you.
Thank you.
The evaluation forms.
Good morning.
Good morning.
Morning.
Good morning. Nice to have you.
Thank you. Nice
Would
to
like
be
to introduce
here.
yourselves?
How many years have we been seeing you now?
8, 9.
eight.
This is the 9th year, I think. Yeah.
We missed you last year.
Yeah, we did. So my name is Arsina Hovanesian. I'm with CASP, the Committee for MU Students in Public Schools, and Ms. Laura Toyan and I are here to talk about the CASP's Intervention Prevention Clinical Group Counseling Program, which I think most of you are familiar with. We've been working with the schools in Glendale for the last 9 years with this program, and unfortunately, last year, due to lack of funding, the students at Columbus and Keppel missed out, and the parents and teachers really missed this program. But so we're on hiatus, and we're hoping to bring it back to them. And I just want to reiterate that this is a really unique counseling program. It provides actual mental therapy help for low-income disadvantaged students who otherwise wouldn't be able to access mental health. And it's during school hours. It's a pull-out program. I mean, everything is in the application, but just to make sure it's not confused with other kinds of programs. And it's done in a group setting during school hours. And I'd like Ms. Laura to continue.
I just want to thank you again for possibly funding us. And what I would like to really drive home is that in the wake of the tragedy at Sandy Hook Elementary School in Connecticut, most probably early intervention and mental health services is going to be part of the national conversation. And first, I'd like to congratulate the City of Glendale for having already funded such a program for all these years. You are at the forefront of it, you have been, and this is the time to continue, really, because this is not about this year, this is not about scores, this is not about next year, this is about 10, 15, 20, 40 years down the road, when we know that these little kids we help are going to become most probably disciplined, functional adults in the community. If you've read the proposal, you probably have noticed that the expulsion rate for elementary school students is pretty high. It goes between 15 and 25%, and that is usually an early indicator of trouble down the road if it's not addressed. And we worry about sending these kids to middle school and high school with those kinds of expulsion rates. The other thing I want to say is that we try to track the kids we serve, and in doing that, I can say that we cannot identify the kids who have received service from us at the daily continuation high school. We do not see them there later on. So that says a lot about the program. So it does make a difference, and we would really appreciate it if you would consider reinstating us. Because it's not about just 2 schools, 3 schools, 1 school. It's about the whole country. All schools need this, whether it's a district that does it, whether it's a city, whether it's a county. Early age mental health service is really important, so we don't get to have the likes of the people who commit the mayhem that was committed in Sandy Hook. Thank you so much.
Thank you.
Any questions?
Any questions here?
I have some questions. So for us and for the audience in general, I want to have a clear understanding of how the program is different from whatever else is out there, because as part of your application, there's quite detailed, actually, explanation of it. I want to make sure that we are all very clear on that, because that was the bane of last year's.
Yes.
Okay.
So we are a pull-out program during school hours. The at-risk students are identified by their teachers and administrators. Students who have been starting to exhibit certain at-risk erratic behavior are referred to the program, and the psychologist and her staff start working with the kids, putting them into different groups based on issues, based on age, etc. And it's once a week for 3 10-week sessions, 30 weeks throughout the school year. And they work with the students, if need be, with the parents. And there's pre-tests and post-tests and all sorts of follow-up to make sure that that we meet our outcomes and the students start showing better behavior.
Okay. And the funds that are being requested from CDBG, what percentage of the general budget that you foresee for the next year does that constitute?
It's less than half.
Less than half?
Less than half.
Okay, great. Okay.
And remember, it's really cost-effective. At the rate of less than $10 an hour per student, where are you going to get this kind of stuff?
And how many students do you project on the
About
survey?
75.
If all three schools
If all
are-
3 schools are funded,
all three schools.
25 per school.
Okay, so which is the 43,900?
Right.
Yes.
Okay, that's all I have.
First of all, unfortunately, I wasn't here last year, but I'm very familiar with your program. And I have to commend you on your passion for the program and coming back here again. Obviously, our perspective, national perspective, has changed, and I truly understand the value of dealing with a young person and how that shapes you into the future. But can you tell me, when you say you're in hiatus, was that only the 2 schools, or was that your entire program last year?
Well, the program is in 2 schools. We've only had enough funding to provide services in 2 schools.
Okay, so you really didn't, there were, I don't know how many, 75 kids, I would imagine, or about that did not get served
They did not.
last year.
And those who, let's say, were 3rd graders, were going into the 4th grade, and possibly were going to continue with the program,
Stop.
lost it. It stopped. So whatever progress they had made, most probably there's still some, remnants of it, but it would have helped them to have been again in the program, so that when they go to middle school, they are ready. They're not going to be in trouble. They're going to know what to do. They're going to do homework. They're going to follow directions. They're not going to bite. They're not going to kick. They're not going to throw things at each other. So that's really the key.
Okay. Now, of the funding you're requesting, is there a bare minimum from CDBG that would still retain a significant portion of the program?
A minimum of $15,000 per school
Per school,
is needed, per school, for us to really do a full program.
30 weeks, which covers the school year.
Great, thank you.
Can I, just a quick follow-up?
You may.
Mr. Chair. I hate to harp on this issue, but I want to make sure that the problem that we had last year does not occur again. And for that reason, I'm asking, can you talk about how your program is different from for example, Glendale Healthy Kids? Because on paper, they provide access for Glendale Public School students to mental health issues. So,
I don't want to speak for Glendale Healthy
Right.
Kids, but I am familiar.
Speak for yourselves, right,
Yeah, I'm
exactly.
familiar with their program. Our program is at the school site during school hours, pull-out counseling program.
right then and there.
It's right then and there in a classroom. The kids are pulled out from the classroom, taken to another classroom, and for one period a week.
And there's no one that does that, right? I haven't heard of
That we
anyone
know of,
providing
not
that
that
kind of
we know.
service.
Especially in a group setting.
Right.
Now, again, I don't want to speak for anyone else, but other programs provide access to health care outside of the school, maybe after school, et cetera. But again, I don't want to speak for anyone else.
The value of our program is in the fact that these kids get to learn, get to develop new social skills, new ways of behavior with their peers. So they're all together in the same boat, and they learn to communicate. They learn to help each other. They learn, it becomes part of the social skills that will travel with them for the rest of their lives. And whereas the other programs refer a child to a psychologist, it's one-on-one. The opportunity to be part of a group is really unique to our program.
And because most of these kids are not able to access this kind of care after school, whether for economic reasons or get there, this is something that's provided to them right there on the spot. So the teachers see the progress during school. They see it. And just to add one more thing, if I may, Ms. Jill Firstman, who is taking care of this program, who's implementing it for us at Columbus Elementary, she couldn't be here today because she's teaching a class, but she did want me to say that this year they have really felt the void, and the parents and the teachers have been asking for it all the time, saying, when is the program coming back so we can help these kids?
I have a couple more questions, if I may.
Yes, sir, follow up.
I think we've asked you this every time you've come, so just to get it out there, the name of the program seems ethnically specific, but I believe that has absolutely nothing to do with the actual program
Well,
itself.
the organization's name is Armenian Students in Public Schools,
Right.
but our services are open to all students, and that's the same for our other programs.
In fact, that's one of the prerequisites of our...
And I have to say to that, I recall going to the program, I'm going to say 3 years ago, maybe 4 years ago at Columbus,
Yes.
and I did not see that.
Yeah.
I saw a diversity in the group, so.
Right. And my last question is, I know you said bare minimum of 15,000
Per school.
in order for the program to what would happen if it was something less than 15 per school? What's the outcome? Obviously,
We've done it before,
okay.
so we don't like to do it, but we've done it
Okay.
before.
That 15,000 includes so much already leveraged. I mean, it's really
Yeah.
down to the bare minimum.
I'm
If
sure
you look
that's
at the
the case.
budget, you'll see. But really, as long as we can bring this program back, we'll do whatever.
Thank you very much.
Okay.
Thanks for
Thank
the service that you
Thank you
provide.
for your time.
Thank you.
Thank you for coming, and appreciate it, and see if we can do a better job at it.
Thank you.
Thank
Looking
you.
forward to
Appreciate
it.
it.
Thanks a lot.
Thank you. Bye-bye.
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 Evaluation forms? Good morning.
Morning.
Nice to have you.
Morning.
My name is Moeed Khan. I'm with Catholic Charities. I'm the regional director. It's been my privilege to come before you for many years. I'm here to represent Catholic Charities at the Glendale Community Center, Loaves and Fishes program, and their homeless prevention program. I started the Loaves and Fishes program in 1984, as you can see from my hair, and I've been there a long time, and it has been a wonderful partnership with the city of Glendale. I apologize, Laura Young, that some of you have met in the past, does the program, coordinates the program, has been with the flu and then also had car problems. So I'll do my best to answer some of the direct operational issues. But I did start, the Loaves and Fishes program and designed the homeless prevention program. This is unique in the city of Glendale. We have partnered very exciting kind of direction with the city when we participated with the continuum of care. If my memory serves me correctly, that what we started here in the city of Glendale was the model for what HUD became the continuum of care program eventually. So what what we try to do is, because of the economy, because of the people on fixed income, like senior citizens, who may be in the danger of being evicted from their homes because they cannot pay, they had unexpected expenses, medical or whatever. They cannot pay the electricity bill, or sometimes they may lack some funding. They may have run short on funds that they cannot come up with the full rent. So what we do is we have combined this program, and city has allowed us that we have ESG funding along with CDBG that pays primarily for the case management services. I remember a couple of years ago you asked me, I keep asking for more money. This year I listened and just asked for...
You're not alone.
So we asked for less, one person, and it's critical that we have a staff that can manage both programs. It's been a very challenging year. People say that economy is improving, but we don't, people who are poor and in need and fixed income, they continue to struggle. And it's a unique program for the city, and we greatly appreciate the support we have received in the past, and we hope that this is a very basic need program will continue to be your priority, and you'll recommend us for funding for the next year as well. So with that, if you have any questions, I will be happy to answer as best as I can, and if I can't, we will be happy to provide the city when I get a chance to talk to Laura.
Any follow-up?
Yeah, just a quick question. And again, we're very familiar with what you've done over the years. It's a great program. Of the CDBG funding, 89% will be allocated to the case manager?
Basically, all of the fund will be.
So that's
But
targeted towards one.
that
one
doesn't
money.
cover the entire cost of
Okay.
the program. We, Catholic Charities, supplements that funds because that does not totally cover the full cost of the program.
Okay, so if the amount was less, then what does that do to this particular position and their salary, or how does that?
Well, it has, as you can see, that has been continuing, the government funding has been cut. And depends on, my hope is that this is kind of the bare minimum that we are able to, ask for. We didn't ask last year like in the previous year. We asked for to fund additional position and what have you. But we hope then the challenge for us for Catholic Charities is that if you notice that I'm very fortunate to be part of Catholic Charities, that we are able to augment some of the funds from within the corporate funds, so supports us. But our hope is that you will fund us at least what we asked.
So would it be fair to say then that if you receive the amount that you're requesting, you would maintain the same level of service you're currently providing?
Yes. Yeah. See, historically, Catholic Charities, what we have made a commitment to, our record has shown that we have lived up to it. Say, for example, if the funding, in the last years, it was very, very tough because the FEMA funds, now they're called EFSP funds, were held back at the Congress. It impacted a lot of agencies, tremendous amount of, some of the agencies, because if you read the UCLA report, depend very heavily on the government funding, and subsequently there was a lot of impact because of that. But we were able to continue to function as best as we could.
Thank you.
Just not a question, but more of a comment. I appreciate the fact that you're asking for less money than you asked for last year. I mean, just the reality of the circumstances is such that this year we have 20,000 less that we have available to allocate, unfortunately. So this trend is not getting any better. And, either we're being asked for more money this year or at least not any less than we were asked last year. So it is what it is. We'll try to do our best.
Yeah, I appreciate your comment because, as I said, things are getting tougher.
And we also appreciate your endeavor and that of your staff there at your place and what you do for the residents here. You've done it many years. You've done a professional job. And it's, so we're a recipient of that at this end, knowing your grade level. So we always take that into consideration. And we appreciate your condolences there and knowing what we have to go through here when we make the allocations and the funding process here. It's not an easy task.
I agree.
But you do a remarkable job, and that's number one that we keep in mind.
Thank you very much.
Thank you.
Thank you.
Thank you.
Okay, no further questions. Thank you. Evaluation forms? Okay, our next speaker for the All for Health, the GIFT.
Not a problem.
Okay. Good morning.
Good morning. If you can introduce yourself and your colleagues there.
Sure. My name is Larry Fernandez, and I'm coming as part of All for Health.
I'm Dr. Arthur Pagosian. I'm a child psychiatrist.
My name is Jermaine Strickland. Good morning.
And nice to have you.
This morning we're coming in. Sorry.
Oh, one more.
My name is Adrina Ibrahimi, and I'm the CFO of All for Health, Health for All.
Thank you. Thank you for coming.
Morning. This morning we're coming in to attempt a partnership, as you would see, with All for Health and with the GIFT program to be able to do something that we've done for some time now, and providing mental health treatment along with the addiction services for adolescents in a supportive manner to the community based on the need that currently exists. We've provided you a few slides there that identify a particular model that we've used. It's been very successful. And the plan is for us to be able to transition that model in as quickly as possible and to be able to do the services that the community needs. The model in itself, as you look through the slides, just give you a brief background regarding the GIFT component, which encompasses a variety of parenting services, individual counseling, and drug and alcohol related services and treatment, which are primarily all done by licensed individuals of the graduate level and above. Also utilizing student academic interns from noted universities that we have affiliations with already. The opportunity with this also leads to be able to make sure that we do services that are culturally relevant to the community, both linguistically but also knowledgeable to the current culture. As you scroll down in there, you'll see something that's called a treatment philosophy. The philosophy is a triangular philosophy that allows for us to be able to meet and interview someone and attempt to find out the level of need that the person has. What we've noted is that in the past, treatment has been offered to youth, all in a nutshell format, if you will, everyone the same type of treatment. And what we're noticing is that there's different youth with different needs. And so this would allow for us to really identify the needs that they have, and then ideally provide the independent services that they and the family also may need. All for Health would be providing the supportive element of us working in a circular format to be also being able to meet the needs of the medical services that they may need. Any medical services that they will need, it would be pretty much a wraparound style service that would allow for the family and the individual to get all the services that they need to be met, all in a one format kind of location, if you will. I'm not sure if there's a particular question or anything of that nature that we were going to be answering, but I wanted to be as brief as possible.
Oh, fine. Do any of your colleagues here have anything like to add?
I can just add that I know Dr. Janayan for many years, and I know All for Health has been providing this sensitive and professional services, and we have always been looking forward to add mental health component to that, because clearly mental health part in the city is underserved. Actually, all over the country it's underserved, but we can at least look from our city perspective. It is underserved, and there is tremendous need to provide these services to youth. And and I have been working with different agencies, including Child and Family Guidance Center and Massa Youth Services since 2007. I always wanted to bring on this collaboration, and this is a wonderful opportunity that All for Health is taking kind of responsibility to take challenge of providing mental health services, and the rich experience that Mr. Larry and Jermaine and have, and actually three of us have, working with inner city youth who are coming out right from juvenile hall. And sometimes I really want someone to come and see the type of services we provide at Massa Youth Services. And again, personally, I always wanted similar services with similar compassion to be provided in the city of Glendale. And this is a wonderful opportunity for us to start doing that.
Anyone else would like to say a few words here? Okay. So you're open for questions now then?
Yes.
Okay.
I think they're waiting.
Waiting for the questions.
I'll start.
Okay.
You don't mind, I'll start.
Okay.
What would be the primary difference between what you provide versus what some of the other youth-oriented mental organizations, the services they provide?
Well, one of the most unique services differentiation is what we call evidence-based practices, and these are noted services that have been not only through research found to be effective, but also address things that are in specific format, for instance, trauma-related services that are causing addiction, that are causing mental health routine issues to come up. And because they are specialized and have been researched to be effective, right now, many of the providers are not doing that. Part of it is because it does require an intense amount of training. And we have not only been trained in it, we have been effectively able to train our people who are working with us to be able to do that. And so if there's a clear difference, it would be that. The level of competency that the staff is bringing and cultural awareness would be that.
And to follow up with that, pardon my ignorance, but when you say trauma-related, and you're probably talking about a very specific sector, if you will, of youth who need this service. But from where I stand, I'm not aware of it.
Right.
So how do we, one of the things we need to look into these applications is justification of need.
Right.
How do you assess that? How do you come up with the need and how important it is?
Okay, the one unfortunate caveat when it comes to trauma is that it's really underscoped in terms of the actual word. Trauma could be anything as minimal as witnessing domestic violence, being robbed on the street, to everything as being a family member being killed, someone being deported, sexual abuse, physical abuse. And what has been noted in research most recently is that the amount of addiction or mental health treatment is parallel in need with the people that are coming in with these kind of diagnosis or symptoms. So our communities definitely have the need. It's just oftentimes taboo to speak about them. Thank you.
I had a question here. I didn't see it in your packet. Perhaps you can elaborate on it. How long have you been serving the city of Glendale?
Well, All for Health, Health for All used to be called Broadway Family Medical Center, and it's been serving the community of Glendale for over 25 years. It did become a nonprofit organization in 1994, and in 2004 it became a federally qualified health center. When it became a nonprofit organization, it changed the name from Broadway Family Medical Center to All for Health, Health for All. And in 2004, it became a federally qualified health center lookalike, and in 2009, it became a federally qualified health center and started receiving grants under Section 330 of the...
How long have you been with the organization?
I have been with the organization for about 2.5 years. And Dr. Janoyan, the CEO of the organization, is the founder of the organization.
I have a quick question for staff. So this group was not in front of our advisory committee last year?
This group actually did request funds last year.
Okay, so...
However, it was a different program. It was a youth program, so we did not put the request
I
funds.
see. Okay.
So that was kind of an area we weren't sure, but they did request funds.
Okay,
and
that's how I remember it.
yes.
That's all I had.
Have any more questions? Thank you.
Any other questions? Thank you for coming. Appreciate your input here.
Okay, thank you.
And now I want to know why our city clerk is here with a bunch of kids.
Oh, yeah.
There it is, right?
Okay. You want to take the podium?
We apologize for the intrusion. We're giving a tour to the students of Daly High School of City Hall, and it was very fortuitous that today the CDBG Commission is dealing with your very important work, so they're going to see you guys in action. So thank you very much.
Already no apology when kids are involved.
Absolutely. I'd like to make a suggestion. Pick two of them and have them come up and say a couple of words.
That'd be great, yeah.
You got time for
What they're doing.
Not sure if that's in the agenda, but hey.
Hey.
All right.
This is fun.
It doesn't look like the next party's here anyway.
Right.
So
They're not here yet.
They're not here yet anyway.
No, I'm just kidding.
Here we go.
Good.
Okay.
Two brave souls.
You have to tell them they have to speak in another language.
Nice to have you both. If you
Good
can
morning.
give us your good name.
Your name?
Your names, please.
My name's Gabriel.
Jacqueline.
Okay. You're welcome. First of all, we're happy to have you. And second, we'd like if you can say a few words.
I'm in 12th grade. I'm going to graduate like a week from now. We'll both be done with,
both of us.
with high school, and we're from Daly.
Why are you here? Are you in City Hall?
We're touring around the City Hall to see how it is.
How it runs
like,
and how
yeah.
it functions.
Not just from books or like internet, but to see like in person.
So tell me, you're graduating in a couple of weeks, you said. And where are you going to be next year at this time?
I'm not sure. I'm undecided like what I'm gonna do, but I want to do either like design or culinary arts.
Pretty good. Yeah. Gabriel, what are you
I
going to
start PCC in June. I want to go into social working.
That's kind of like what
You're
we're doing
in the
here.
right place right now.
Yeah.
Are you ready?
You're up next. I'd like to hear from you. Say a few words.
I'm from Daly too. I graduated in March, same time as her, and yeah.
Okay.
I can tell they're still in high school.
I think the cameras have made them a little bit shyer, and they were asking excellent questions just now when we were meeting in the management services room. So they're going to be sitting here and observing your proceedings for
Okay.
a few minutes, and then we'll be out of your way.
Well, welcome to all of you.
We're happy to have you.
Welcome.
And thanks for coming.
Mr. Chair, members of the committee, we do have agency here that's for 11:15. 11 o'clock is not here.
We'll take.
We're a little early.
So we're going
If you'd like to do,
Let's see.
like to jump
Jump
ahead.
ahead with one.
Is Mr. Alvarez here or anyone from the Youth and Family Services?
They're not here yet.
Not here. Okay.
Well, so do we have
The next one.
employment program?
Next one would be number 10.
They're not here.
She's here.
Well,
GYA is here.
I see number 11 is not here.
Let's go to 12 then.
Is anyone
11
here?
is here. 11 is here.
11 is here?
10 is not here, but 11 is, correct?
Anyone here from GWA, GYA? Oh, okay. You're early, but I see your predecessor is not here yet, so you're welcome to
Yes.
come at this time.
I was asked to come and speak with you today. Good morning. I'm Elisa Janarian. I'm with the Glendale Youth Alliance. As we all know, jobs change life. A job can change the life of an adult professional who's been in the workforce for years. But even more so, a job is a catalyst, a big catalyst for a change in the life of a young man or a woman who's seeking to find their place in the world, in the workforce, and to become self-sustaining. GYA programs change lives, and we as the staff witness it every day. The youth we serve get off public assistance programs such as general relief or welfare. They become consumers and taxpayers, benefiting the community in general. GYA's track record includes youth who were relieved from probations as they build credibility with the court system by finding jobs and becoming self-reliant. The youth who we've placed in jobs save money, purchase cars, improve their standards of living, and become more able to grow in the workforce and to find other opportunities, again, serving the community as a whole. GYA participants who are placed in employment mature in a very short time as they transform into breadwinners at this age of early or late teenagers or early 20s. They transform into breadwinners or caretakers of family members, and this enhances their maturity level and their willingness to do more and become more. In addition to assisting youth from low-income families, GYA assists youth with further barriers to employment, such as foster youth, youth who are parenting, youth who have disabilities, youth who have probation. These groups generally have a more difficult time in entering the workforce. And so GYA programs are there to help these groups in particular give our special efforts to find these groups with their employment needs. These are some of the examples that GYA programs change lives. And we've been doing this for the past 20 years. GYA executed 16 CDBG programs successfully. Glendale Youth Alliance has a unique understanding and experience in operating youth programs. We are the only agency in Glendale that provides youth with jobs. Employment services continue to be an important and pressing issue in our community and all communities across the nation. And we have a successful track record of executing such programs. I'll be more than happy to answer any questions you might have.
Any questions for Corinne?
Just a comment, we've visited you in the past, and it's a great program, well-established, great track record, so keep up the good work.
Thank you.
We'll try to do what's possible under the circumstances.
Yeah, we're very familiar with your program, and you said 16 years with CDBG?
Well, GYA is a 20-year-old organization, but we executed 16 CDBG programs successfully. That's our.
I forget how long I've been in this committee, somewhere around 15 years, and I think I've seen GYA just about every year. And something that's really important for me is that some of the kids that do get the service, I have seen in the community.
Mm-hmm.
And I see them in my neighborhood. I see them working around town and so on. So I know it's a great program. It also happens to be one of our city council's priorities.
I'm personally proud to be here and to speak with you and get the assistance from this committee.
We will do our best to get you as much as we can. Thank you.
Thank you.
Corinne, just wanted to say,
Yes.
we're all familiar with the constructive work you do on behalf of the youth. I think you're very unique in that category. That you just dwell on the youth here, it is very important. That they get a good start to learn the value of what work is, the ethics behind it, as well as the hard work, and knowing that if you're going to succeed, that it's going to take hard work to do it. And you do an excellent job with that category. And we know from experience when we take the tour to see you afterwards, see you in action in what you do, is very constructive, and we're very fortunate to have you here in the city of Glendale and the work you do on behalf of the kids.
It's our privilege. It's our privilege to serve the community and the youth. We have a lot of passion for what we do.
And well, thank you again.
Thank you.
For coming up.
Mr. Chair?
Right.
If I may? Mr. Chair, if I may?
Yes.
And I want to put you on the spot, and Lisa, but while they're leaving, I was going to say, you want to say anything about GYA to the students here that ever want to get a job?
Wait for me a few seconds.
Okay.
Okay.
All right.
Okay.
Okay. Thank you. Thanks, Lisa.
Thank you.
That's fine. Thank you.
Okay.
Thank you.
Thank you. The evaluation forms?
Are we ahead of schedule? Is that what's happening?
Yes, we are a little ahead.
Even for number
11
9?
o'clock is, they're on their way.
Okay. So what do we do?
A break, if you'd like to take a break.
You want to
Check
call
your
for a
email.
5-minute break? Well, we're still on we're still live.
No,
so.
No, I want to do well. We'll hold forth here.
Look, we keep getting, well, we some,
Oh,
we get,
we have
we
the
get
next
the
groups
high
here.
school ones, now we
Hey.
get the
They're
little.
11 o'clock.
So this is 10, right?
All age groups here, huh? Okay, we're ready to send a posse after you.
Hi, good morning.
Nice to have you.
Chairperson Cornell, CDBG members. My name is Walter Alvarez. I'm the program community services supervisor for the Youth and Family Services program. The Youth and Family Services program has been in existence for approximately 11 years now. It started receiving funding back in 2001 and eventually got launched in 2002, so approximately 10, 11 years of service that we've been rendering in the community. It is a city-sponsored program funded through the city as well as CDBG funds. The purpose of Youth and Family Services is to provide outreach, provide information and referrals, and conduct case management to at-risk youth, high-risk youth, those primarily involved with probation, and also provide information and referrals to families, families seeking services, specifically social services in various areas, whether needs for housing, need for healthcare services, need for mental health services. One of our strongest collaboratives is the probation department and the Pasadena Juvenile Court. A lot of times those youth come to us and they are required to comply with court orders, whether doing community service, the need to comply with that, the need to comply with case management, and various school-based resources as well that they have to improve grade, obtain tutoring services. So that's where we play a role for them. a lot of times the parents don't have time, they don't have the resources, they don't have, or they have obstacles to access those resources. As us, as a city entity, we kind of, they come to us and they always say, you know, folks in the city could be able to link us to these services, especially with various partnerships we have, nonprofits in the community. This year, we expect for the following year, we are requesting $39,259 or 275 to augment a position for a provided position, community services specialist position, a case manager to be able to assist with all those needs of the program. We plan to target to serve 50 families, 50 youth. Of those 50, we plan that 20 of those youth will be provided case management services and identifying through a intake process, identifying the needs. Not all of them will receive case management. Some of them are just one-time referral needs. Those who we identify as case management needs will go ahead and provide the intensive case management on as-need basis. We hope that of those 20, 10 will be through probation department or needing assistance, and we will successfully comply with that case plan, being able to refer them to the services and be able to comply with their court mandates. And that's kind of in a nutshell who we are and what we plan to do with this upcoming year. Any questions?
Any question for Mr. Alvarez?
I have a comment and a question.
Sure.
Again, we're familiar with your organization. We've been to your place. Are you still in the same location?
That's the other question. No, that's one thing I did miss. Currently, we're not. Youth and Family Services last year went through, because of the budget reductions within our department and various other sections of the city, well, our funding for the one-on-one was minimized, so our goal was to go ahead and consolidate services. One of the needs was to reduce costs within our department, so what we decided to do is move over to Pacific Community Center. It brought about challenges because in that transition we kind of lost our ability to do some outreach because people were identifying the house, and primarily we were serving the Glendale High School cluster of youth. And so once we transitioned over to Pacific, that's a different cluster of kids, which that corresponds to the Hoover cluster. So we need to go back and do the outreach efforts and be able to get out there more in that section of the community. We are now at Pacific Community Center, and it will bring about challenges, but with it opportunities, because we do have, it's a center-based programming now. We have resources, we have recreation, we have a gym, so I see potential for growth in the program. I know we went down, but I see opportunity there.
Okay, and then basic question is, last year you were funded $10,000.
Correct.
You're asking for 39. They're in between here. Tell me what happens if you get 10,000 again? How does that affect you?
If we get 10,000, we would reallocate that into maintenance and operation costs versus doing a staff costs need, and really just kind of roll up our sleeves and do the best we can to provide the services. With the 10,000, what we did last year, because that was the same case, we requested the 39. We transferred that into maintenance and operations costs. With that funding, we were able to go out there and see services where we can link the kids and pay for those kids to participate in services. I'll give you an example of that. California State Parks has a program called Outdoor Youth Connections. It's a 3-day leadership training. So that's where we just took a total of 8 kids. We paid for the training, which was at $30 a cost per youth. And we used that funding to be able to take these kids on that outing because we paid for transportation, snack costs, as well as registration costs. So that's where we say, well, we'll use that and take the kids to the services that are out there versus us reinventing the wheel and providing our own services. So we made good use of the funding as we went along.
Now, are those 3 little ones yours?
Yes, they are. They had to come with me today.
I've been in that position, so it's a great thing for them to see you at work.
You want to introduce them, Mr. Alvarez?
No,
it's okay. They're camera shy.
Oh, okay.
Happily that.
Oh, okay.
Thank you.
Thank you.
Okay.
Thank you.
Thank you very much.
Well, I have something, Mr. Alvarez, here. I see you're at the Pacific Center now. What happened to your place that we visited a couple times around there on Maple?
Sure.
Is that still in play?
At Cedar House Heritage, yes, it's still in
Cedar
place.
is it? Yeah.
The goal for that is to, currently our department has gone out for an RFP process to try to provide related services in the areas that we were providing and cover that gap for that area again, because it is through going through RFP. There is currently an agency, if I can mention it, there's an interest from All for Health, Health for All, to be able to do some case management and outreach some youth in that community and be able to continue services in that home.
Okay, so you still operate out
Keeping
of
an
that?
eye on it as well. We go out there randomly, we try to get kids in that area to maintain it to the best.
If I may, that's interesting because we just heard from All for Health. So you're familiar with that program?
Yes.
Something you would recommend?
But I'm not in the position
You're
to
not-
make
okay.
recommendations.
Well, no, I'm sorry. Let me rephrase the question. Are you aware of the services they provide?
Yes.
Okay.
Yes, I am.
So the city's, okay, great, thank you.
Mr. Chair?
Yeah.
Mr. Chair, if I
Yeah,
can just
go ahead,
add,
Mr.
the point,
Brown.
Mr. Olivares, yes, that's a good point. With the Cedar House, with staff moving from the Cedar House over to the Pacific Community Center, that left the Cedar House vacant. So staff has been discussing different alternatives, and certainly our concern is keeping the place with an occupant to watch the house and watch the park. And what we've also discussed is that we need also some additional services in the community in that area. So the city did go out for an RFP to provide youth services for the community, allowing an agency to lease a very minimal amount the house and provide youth services, youth and family services. We actually did receive a proposal from All for Health, Health for All, the GIFT program. We had interest from 5 other community nonprofit agencies. They were the only ones who applied. And actually, staff is recommending to the City Council to allow All for Health, Health for All, the opportunity to utilize the Cedar House so that they can operate the program. You actually just heard. So that is a program that we are allowing, will request council to allow to use at the Cedar House. So it is something that we want to emphasize, that our community centers are not just for the city, but it's also for other partners in the community as we make them available. So as we consolidate, we do offer opportunities for agencies to utilize the services. Now, it has not been approved by council, so there's no, but it's something we do definitely like to have with our agencies.
Do you pay rent at Pacific?
No.
You have use of the facilities that
Exclusive
benefit
use.
from the city?
Correct.
Mr. Alvarez, there's something here I noticed, and I'm confused on it, because you do have a separate senior services. And I notice here that you have a senior care management in your portfolio here. And I was wondering the percentage that you have for that particular care. And does that intermingle with your senior services section that you have, which I see is coming up here, that is a separate entity?
Correct. The reason we list that is because we're under the umbrella of human services, and those two components fall under that umbrella. Human services includes youth and family services as well as senior services. So we identify both in our report, because the senior services is managed by another supervisor, Maggie Kavarian. But we indicate that we are a full service, if we could say. We target youth, families, and senior needs within our department.
Okay, fine, okay. That clears it up, Ed. No. Any further questions for Mr. Alvarez? Mr. Alvarez, thank you.
Thank you for the
coming up
opportunity.
and bringing your lovely family as well.
Thank you. Have a
Okay.
good day. Bye-bye.
Okay, evaluation forms?
His day off today. Yeah. Cool today. To propose a little 5-minute break since we're ahead of this school year. Amazing.
We're doing, maybe we're not asking enough questions, huh?
Oh, there's three of us. So.
Yeah.
And that, by the way, is not a commentary on our fellow committee members. It's just.
Okay. Okay. If that's the case, why don't we propose a break then to 11:30 to our next speaker? Okay.